Good morning, everyone. My name is Simran Chaudhary, and I welcome you all to HeartWise Talks brought to you by Voice of Healthcare. In honor of World Heart Day 2024, we present our special series Heart Smart 2024 Act Now for a Healthier Tomorrow. This series is dedicated to empowering you with vital knowledge about heart health. Our theme, Use Heart for Action, reflects our commitment to promoting heart disease prevention, encouraging regular health checkups, and advocating for cardiovascular health priorities. Today, for this episode, we have with us Dr. Brajesh Kumar Mishra, a renowned cardiologist with over 24 years of experience. Dr. Mishra specializes in interventional cardiology, pacemaker implants, and cardiac electrophysiology. His expertise in treating complex heart conditions, coupled with his dedication to patients' care, has made him a leading figure in the field. He is an active member of the Indian Medical Association and Indian Heart Rhythm Society. And today he is going to share his insights on heart health for World Heart Day. Welcome to our show, Dr. Kumar.
Thank you. Thank you very much for inviting me on this platform.
Thanks a lot for coming to our show, and you're ready to share your insights to spread awareness on World Heart Day, so that every person out there, every listeners out there is aware and a little cautious about what else they can do to keep their heart and themselves healthy. So, starting with, I would like to know, Dr. Mishra, you have over 2 decades of experience in cardiology. From your perspective, what are the most pressing issues in heart health today?
You know that cardiovascular health or myocardial infarction and stroke is emerging in current scenario because of this is basically a lifestyle disease, and today in today's world everyone is stressed out. You know that smoking is growing very fast. The You don't have time to sit comfortably, relax, do yoga, meditation. You don't have time to cook a better healthy food. You go on a trees and eat junk food. These are the things which is probably, and the stress is nowadays, which is common and very common in everyone's life, and these all are contributing to rising incidence of stroke and myocardial infarction, I think.
Thank you so much. You explained that in a very simple and layman language so that it directly hits to the listeners that okay, this is exactly what you guys are doing wrong. And thank you so much. And like we also have to understand on the early signs and symptoms. If a person is maybe suffer, they may suffer from any kind of heart health condition. So many heart conditions develop silently. So, by early symptoms should people what early symptoms should people be aware of to prevent heart issues, and when should they seek medical advice?
Okay. Basically, whenever there is disease which is happening, it gives you a warning signs. And we know that these lifestyle disease like a stroke, like myocardial infarction, although present acutely, but evolve throughout the years and decades. It's your lifestyle which causes creation of plaques and cholesterol deposits. It's very important to understand the risk factor. If you have a family history of heart disease or a family history of dyslipidemia, hypertension, diabetes, you have to be aware from very beginning of your a second or third decade of your life. For universally, if you see the fourth and fifth decade, this is a commoner thing to listen that someone has a myocardial infarction or a stroke. Therefore, the first thing is that if there is family history, if there is some genetic component, if you have a family history of diabetes and hypertension, you have to screen more frequently than a normal population जिनको ये symptoms नहीं हो रहे हों, if they don't have the symptoms. So, what are the things you have to look for? Sometimes, you can find on your face there are some plaque or cholesterol deposit, which is known as genthalasmas. There are white spots on the upper eyelid of your eyes. Sometimes you get cramps on walking. It means that the vessels in the legs are clogging. Because of that, you are getting these blockages in your lower limb vessels, which is causing cramps. Next is that when you see that there is any transient weakness which has resolved, it means that there is a very small clot which has moved to the brain and has resolved, and that is one of the warning sign that you may get a major stroke. And if it is so, you have to aware that this is the right time to go for a complete evaluation. And sometimes, from the heart perspective, it's the chest pain or angina, which is not a very classical symptom every time that you will get, like, oh, that classical description of central chest pain radiating to arm, radiating to jaw, radiating to neck. And this is the classical bookish description. But in certain special circumstances, like if you have a diabetes, long-standing diabetes, if you have a chronic kidney disease, or some radiation therapy you have received, in those things your pain sensation gets modified. And if you have symptoms, even a dyspnea or a breathlessness, what we call in a layman's term, then you need a complete evaluation and a complete diagnosis to know that what is your cardiac health and what is your vascular health.
So you explained all the symptoms to us very simply, and it is very easy to understand and to relate to every layman person out there listening to this, if in case they have ever suffered this or gone through it, or seen people around them, discussing all those symptoms. So now I believe it is very relatable to them to understand, okay, these are the few silent symptoms and they should be aware of it. And I think the collaborative effort which you, Voice of Healthcare, and we guys are doing together to spread this awareness will actually work on the field. So when we talk about, so we just discussed about the early signs and symptoms, but now moving on the lifestyle choices. Lifestyle is often linked to heart disease. In your experience, what daily habits, whether related to diet or physical activities or taking some kind of work stress or something, have the biggest impact on heart health?
Whenever we discuss cardiovascular risk factor, the most important thing which we have to understand, that why we are discussing from the point of view of, or from the perspective of prevention. If you see the literature, medical literature, and they say that 2019 guideline of American Heart Association say that if they have analyzed the data of all myocardial infarction patient or heart attack patient, and they have found that one of the risk factors was present. And obviously then we want to know that what are those risk factors, and from there the thought comes that can we prevent it, can we prevent myocardial infarction and a stroke? Obviously, if we modified these risk factors, in majority 90% of the case, we can modify the substrate and we can prevent myocardial infarction. And what are those risk factors? Certain risk factor you cannot change. If there is family history, if there is prior history of heart attack, you are more likely to get the heart attack, right? If you have a, like, familial dyslipidemia, a familial abnormal cholesterol, you are more predisposed. If you have a, you are a male, you are more likely to get myocardial infarction than a women who are protected from the cardiovascular disease because of the hormone estrogen and progesterone. But you cannot change. You are a male, you are aging, you cannot hold on aging, because with the age the occurrence of the cardiovascular disease increases progressively. Therefore, what are the things you can prevent to keep yourself healthy? The important things are that you can control your blood pressure, you can control your sugar and diabetes, you can keep your HbA1c below 6.5 or below 7. Then you can control abnormal cholesterol. You can control your obesity, the central obesity, waist hip ratio. You can control your lifestyle. You can de-stress yourself by doing yoga, meditation. You can avoid taking junk meal. You can go for a daily morning walk or a brisk walk, at least 75 minutes brisk walking, intensive activity in a week, or 150 moderate intensity exercise. You should have enough of fruits, salads, and nuts in your meal. There is a concept of Mediterranean diet for prevention of uh, cardiac, cardiac diseases. These are the things which you can do for the prevention. And one the most important thing which we are seeing nowadays are smoking and addiction. And this is one of the emerging risk factor. If you see the younger generation, the most of them who comes with the myocardial infarction, they have a single most important risk factor is the smoking. It is playing a big role in emergence of myocardial infarction or the heart attack in younger population. Quit smoking is a very important thing for prevention of cardiac ailments.
So you just gave us a complete lifestyle or a day chart or a week's chart for a healthy living and for a healthy future. So thank you for that. So I believe there are some also misconceptions around heart diseases. So what are some of the most common myths you have encountered, and how do you educate your patients to help them and make them help them to make informed decisions about their heart health?
The most important thing that the younger population think that they don't need the lifestyle changes, they are perfectly fit. But we know that these diseases evolves through years and years. Therefore, the preventive aspect should be imbibed from early age, so that at the later part of life you are happy, you are healthy. And next most important thing is that smokers generally believe unless until they have a take because of their smoking, they don't understand that this is going to harm you at later part of your life. They feel that, see, I'm smoking since 5 years or 10 years and I'm not getting disease. It's a myth. But no, it's gradually eroding your health, causing progressive damage to your health. Then the next important thing is sometimes they feel that alcohol is protective. Earlier concept was that if you take a 1 2 or 630 or 60 ml of alcohol, that is believed to be a cardioprotective. But this concept is challenged recently. If you see the Interheart study, and they have shown that in the South Asian population, this protection was not there. Why? Because this was linked with the, you know, usually when the South Asian population take drinks, they take drink with the junk. And probably that was the reason, or probably our genetic makeup is not like that European or Caucasians, yeah, or Americans, that we are getting protection from alcohol. Therefore, alcohol adds to your cholesterol, alcohol adds to your calorie value, alcohol adds to your triglyceride, and ultimately this leads to increase in the non-HDL cholesterol, which is a strong risk factor for causation of coronary heart disease.
So you explained a very important factor, because this is one of the thing, or let's say this myth I have heard a lot of time. Normally people who drink, they say, oh, it's good for health. 30 ml or 60 ml, doctors only recommend to us, so that is good for health. But this is one of the biggest myths you are making breaking in this episode, and I think this should go all around our listeners, and people should know that, okay, this is not valid for us. But thank you so much for addressing that to us and to our audience. Lastly, I would like to sum up this with your message, World Heart Day call to action to the public regarding heart health, and if you can add on to the role of mental health in heart disease in this message, because normally people does not think कि अच्छा ऐसा भी कुछ connection है. So I would like if you can address that to us.
Uh, this is a very important risk factor, the mental health. I will discuss about the data which we have about the mental health, and this concept came in 2003 when the Interheart study was published, and they analyzed the data of stress in causation of heart disease, and they summarize it as a risk. How they interpreted it, they asked every patient who came with a myocardial infarction or the heart attack that you have a stress, and they divided the stress into home related stress, they divided into job related stress, they divided it into financial stress, and like these divisions, they divided further into how you perceive it: mild, moderate, and severe. And they compared the severe with the mild, and what they found, that those who perceived their stress as a severe form had a more frequent heart attack and a stroke than those who were thinking that their stress level is low. Therefore, this data, this study has highlighted that importance of how you perceive the stress, how you perceive stressful during your job and at home. That is a very important determinant for causation of heart disease. And the next is that another concept is coming up: caregiver stress. You know, those who have some family members who are chronically ill, and the person who is serving those subset of the population, like a, you know, if you have someone sick at your home, which is like a lung disease, cancer, or these type of stroke, debilitating disease, they also had a more frequent cardiovascular risk. Therefore, by all these analysis, we can say that stress is very important contributor to causation of heart disease and stroke. Therefore, regular yoga, meditation, it has shown in all the guideline. If you see, you analyze the guideline of hypertension, if you see the guideline for atrial fibrillation, if you see the guideline for heart disease, coronary artery disease, everyone highlights the importance of yoga, meditation, and relaxation in controlling your risk factors.
Thank you so much, sir. You explained and answered all my questions in a very beautiful, simple way, and it is very easy for us to an audience to understand and to be cautious and aware of our heart health. And thank you so much for giving your time and sharing your insights and expertise with us in spreading this heart health awareness. Thanks a lot. It means a lot.
Thank you very much. Thank you very much for inviting me on your platform.
Thank you.